Bismillahirrahmanirrahim. Assalamu alaikum everyone. Welcome to my channel. In this video, we are going to discuss different types of muscle contractions. Whether you are a physiotherapy student or just want to know how your muscle work, this video will explain everything about the muscle work like isotonic contractions, concentric, eccentric contractions, isometric, and isokinetic contraction. But if you have not subscribed to my channel yet, please press the subscribe button and hit the bell icon. Let's get started. Let's start with the types of muscle contractions. There are three main types of muscle contractions: isometric, isotonic, isokinetic. Isometric contraction, muscle length remains the same. In isotonic contraction, muscle tension or load or tone remains the same. In isokinetic contraction, the speed at which the movement occurs remains the same. Let's see them in detail. Isometric contraction. We can say the master of stability. Isometric contraction. It occurs when your muscle generates force without changing length. Means muscle contract but without changing length. There is no visible movement of the joint. This type of contraction is often used to stabilize joints and build strength without joint motion. Stabilize the joints and maintain posture. Useful in rehabilitation for patients unable to perform dynamic exercises. Let's see its examples. Plank hold. In this position, core muscles remain contracted, holding the body in rigid position, but their length remains the same. In static lunge hold, leg muscles maintain tension without movement. In static bicep hold, biceps are engaged without changing length while holding a weight. Let's see isometric contractions in physiotherapy. It provides stability, strength, and rehabilitation. Isometric contractions are commonly used in physiotherapy for patients recovering from injuries or surgeries. Since there is no joint movement, isometric exercises are perfect for rebuilding strength without placing too much stress on the joint. Let's see the example. Patient with knee osteoarthritis might do knee press on the floor or on the towel to strengthen their quadriceps without worsening joint pain. As you can see in the video, press the towel with the knee or press the knee on the floor and contract the quadriceps. It strengthens the quadriceps. Next is isotonic. In this contraction, muscle tension or load or tone remains the same. It is divided into two types: concentric muscle contraction and eccentric muscle contraction. Let's see concentric contraction. You can say it is shortening hero. Concentric means towards the center. This type of contraction happens when your muscle shortens under load. This occurs when the muscle overcomes resistance, leading to joint movement. It is common in movements where muscle lift or move a load when lifting or accelerating. Its key point is muscle work against gravity or resistance. Common in activities where muscles are actively lifting something or pushing something. We will see its examples along with eccentric contraction. First, we see eccentric contraction, the controller of descent. Eccentric means from the center. Eccentric contraction, the controller of descent. Eccentric from the center. This type of contraction occurs when your muscle lengthens while maintaining tension. This happens when the muscle resists a load during movement, controlling the descent or returning the body to its starting position. Eccentric contraction is essential for controlling movement and preventing injury. Common in deceleration and lowering phases of exercises. It generates more force than concentric contraction, often leading to muscle soreness. Let's see the examples. When we do bicep curls, then in upward phase, the bicep shortens as you lift the weight towards your shoulder. This is concentric contraction. In bicep curls, when the bicep lengthens as you slowly lower the weight, in downward phase, eccentric contraction happens. Next is squat. In upward phase, the quadriceps contract or shorten when you go back to a standing position. This is concentric contraction. In downward phase, the quadriceps lengthens as you lower down into a squat. This is eccentric contraction. In pull-ups, in upward phase, the back and arm muscles contract as you pull your body up. This is concentric contraction. In downward phase of the pull-ups, the back and arm muscles control the descent as you lower your body down. This is eccentric contraction. Concentric contractions in physiotherapy. It provides power, movement, and strength training. In physiotherapy, concentric exercises are often used to improve muscle strength and endurance. For patients recovering from injuries, concentric movement will rebuild power and coordination. For example, after an ACL surgery, patient may perform concentric quad exercises like leg press to gradually regain strength. Let's see the eccentric contractions in physiotherapy. It provides control, precision, and rehabilitation. Eccentric contractions are vital in physiotherapy, especially in rehabilitation and injury prevention. Eccentric exercises are often used for conditions like tendonitis or after muscle strains. For example, eccentric heel drops are commonly prescribed for patients with Achilles tendonitis to help strengthen and repair the tendon. This is controlled heel drops. Difference between eccentric contraction and normal relaxation. In eccentric contraction, muscle is actively resisting and controlling the lengthening phase. But in normal relaxation, the muscle simply returns to its resting length without any resistance or force. In eccentric contraction, it's like an applying the brakes during a descent. In normal relaxation, think of it as letting your muscles take a break after the work is done. In eccentric contraction, it's all about controlled lengthening under load. But in normal relaxation, the muscle simply relax, rest, and reset. It works hand in hand, concentric, eccentric, and normal relaxation. As you can see in the video, as you lift the weight up, it is concentric contraction when the bicep contracts. Then, as you lower it, you switch to eccentric contraction, controlling the descent. Finally, once the weight is down, your bicep relax, returning to their resting state. This combination of contraction and relaxation ensures smooth and coordinated movements. And the last one is isokinetic contraction. Same speed for targeted strength. When a muscle undergoes an isokinetic contraction, it changes length at the same speed even when the resistance varies. In contrast to isometric, concentric, and eccentric contractions, isokinetic workouts are frequently carried out with the use of specialized equipment or machinery, such as dynamometer, which regulates movement speed while enabling resistance to change dynamically. This kind of contraction, which offers steady and regulated muscular activation, is very advantageous in strength training and rehabilitation. Let's see examples. Isokinetic leg extension or curl. Using a machine that maintains constant speed, patients can strengthen quadriceps and hamstring while controlling joint stress. This is the summary of the contractions. Isometric, isotonic, isokinetic. In isometric, muscle contracts without changing their length, no joint movement. In concentric, muscle shortens while contracting under load. In eccentric, muscle lengthens under load, controlling descent or resistance. Isokinetic, muscle changes length at a constant speed with variable resistance, typically using specialized equipment. Examples of isometric exercises: plank hold, static lunge hold, static bicep hold. Concentric, bicep curls, upward face, squat, upward face. In eccentric, bicep curl, downward face, squat, downward face. Isokinetic, leg extension. In isometric, it stabilizes the joints, used in early rehab to build strength without stress. In concentric, it strengthens the muscles, improves mobility and power. In eccentric, helps in injury prevention, tendon rehabilitation, for example, Achilles tendinopathy. Isokinetic, used in advanced rehab and strength training, precise muscle engagement and assessment. So that concludes our video on muscle contractions. We have covered isometric, isotonic, and isokinetic contractions. exploring their physiotherapy applications. Understand these concepts. It is essential to understand this concept because understanding muscle mechanics in both physiotherapy and fitness is essential. If this video is helpful for you, make sure to like, share, and subscribe. Drop a comment below on what topic you would like us to explore next. Thanks for watching.